Thank you, everybody, for joining us for the Community Foundation of Central Wisconsin's Community Lunch Hour. Today, honoring Women's History Month, we'll be featuring the grantees of the Women's Fund of Portage County to talk through this session with us today. And I just would like to appreciate our philanthropy champions for making these sessions possible. Mid-State Technical College, Century Insurance, Delta Dental, and the University of Wisconsin-Stevens Point.
Hi, everybody. I'm Sarah Ross. I'm the director of the Women's Fund and the Community Grants Program here at the Community Foundation of Central Wisconsin. And I'm really excited to share this awesome panel of humans that we have here today. The Women's Fund is a fund with the Community Foundation that was founded in 1997, and it champions the work of nonprofits who are really centering issues important to women in Portage County. So the fund's been around for quite a while, and we have had an annual grant cycle. And so the guests today on this panel are all grantees from fiscal year 2024. And we're going to be able to engage with them and talk about the impact that these organizations have in our community, especially where women and issues important to women are concerned. So I am joined today by Brianne Constantino. She's with the Stevens Point Area YMCA and serves as the Associate Executive Director. Then we have Mickey Krieger, who's the Assistant Director of Child Caring Incorporated, just a little bit north of us near Mosinee, and Rachel Johnson, who is also with Child Caring Incorporated as the Program and Training Coordinator. Angela Voss with the Boys and Girls Club of Portage County joins us. She's the Director of Operations. Lauren Gantz is the Associate Professor and Women and Gender Studies Coordinator at the University of Wisconsin-Stevens Point. Kathy Junion is the Family Crisis Center Shelter Coordinator with CAP Services. And we're also joined by Stephanie Wirch with CAP Services, who serves as the Youth Mental Health Advocate. She's also co-chair of Prevent Suicide Portage County. So we're going to get right into it. In the last couple of years, the Women's Fund has identified some priority areas that we wanted to engage in with our funding opportunities. These primary areas were developed through the research and some collaborations and opportunities to meet with organizations throughout the community a couple of years ago to see what really were those priority areas that the Women's Fund could really engage. And this information is really supported by the LIFE report that's been coming out, by reports coming from our Health and Human Services. So none of this will come as a surprise, but we are able to gather here and see what kind of good work is being done in Portage County with these amazing nonprofits. So those three areas of impact that I talked about, those three areas of primary funding, were financial stability, childcare access and expansion for Portage County, and also for mental and behavioral health support for women in our county as well. So I want to kind of split this conversation up into those three areas and talk about how each of these nonprofits are working in those areas, and also how they're all very interconnected. And so at any point, if anyone has any questions or comments that they want to come in with, I suggest you use the chat. You can raise your virtual hand, your icon hand, or you can just come off mute and maybe just say, excuse me, so that we can make sure that we get your question in. We'll also have some time specifically for questions at the end of the panel discussion as well. Okay, let's do it. So first off, financial wellness. All these organizations are working in that realm, but I first want to talk about child caring, specifically their Good Start grants program. So an overview of that is that these Good Start grants are a program of child caring, and they provide financial assistance to eligible families in Portage County to ensure that they have access to quality, affordable child care. Families under 300% of the federal poverty level are eligible to receive grants to cover 55 to 65% of their child care tuition. These Good Start grants target ALICE families, including single parent households typically led by mothers. Families in our community that work hard, earn above the federal poverty line, yet can't afford those basic household needs, including childcare. So that's that ALICE population. These families are forced to make tough choices, such as deciding between quality childcare or paying the rent. So today, as I mentioned, we have Mickey Krieger and Rachel Johnson joining us. And I just wonder if y'all could give us a brief overview about that, the Good Start Grants program, and then share a success story or some sort of measurable outcome that you're seeing for your clients in that area of financial wellness.
Had to find the unmute button. So I'm Rachel Johnson, and I'm the program coordinator for Good Start Grants. We have been in the Portage County area. I think this is our 4th year now, or we might be going into our fifth year, providing Good Start Grants to families with support from the Women's Fund and then also the United Way of Portage County. So as Sarah mentioned, we help those families that typically don't qualify for any other type of assistance. So they're not receiving Wisconsin Shares, which is the state child care subsidy program. They typically aren't receiving Badger Care, which is the state's health insurance, or food share, or WIC. Usually our families aren't receiving any of that other types of assistance, but yet are still stuck in this never-ending cycle of trying to get ahead. So Good Start Grants pays between 55 and 65% of their child's tuition directly to the child care provider. Average child care costs in Portage County is not something I pulled up, so maybe Mickey can look real quick and see what the average cost is. For an infant care, it's probably close to $250 a week, if I'd have to guess. So we're covering between 55 and 65% of that, and then families are responsible to pay their remaining parent portion to the provider. So in 2024, we were able to help 19 families with 30 children receiving Good Start Grants. At the end of the funding cycle, or when they are no longer needing the program, we've had some families that move out of the area, or decide to stay home, or just don't need childcare anymore. They are asked to complete a survey that asks how Good Start Grants has helped their family. We're happy to report that 100% of families receiving Good Start Grants in 2024 were able to maintain employment or attend school. They're able to pay their portion of their childcare tuition, and were better able to pay other bills and other basic needs such as food, electric, because of the assistance they receive from Good Start Grants. So we're very, very excited to report that. I do have a little success story from a family that received it. It's a family of 5 in the Stevens Point area who have 2 children in childcare. They are incredibly grateful for the support from Good Start Grant. It has made a huge difference in our lives. Thanks to the grant, our children are receiving the support they need to grow, learn, and thrive in a safe and nurturing environment. It's not just about the financial assistance, it's about the opportunities it has opened up for our family to give our children. We feel incredibly fortunate to have benefited from this program and hope to continue to be supported with it. It has made a positive impact on our family. So we see it, it's not just the financial. The financial help is a huge aspect of the program, but it is also opening up other areas for the family. And then just so far in 2025 here, we have 9 families with 13 children we're helping with Good Start Grants.
So with the need and to be able to sort of sustain, perpetuate, what kind of policy changes, what kind of collaborations or partnerships do you see that are really necessary in order to help address all of these needs?
Funding is a huge one. We need funding. I would say, just to understand that childcare is expensive and it should be like that's a crucial time for our young kiddos, and just that we need outside investments to help make childcare affordable for parents, but also to be able to sustain childcare providers, because really the only income that providers have coming in are the childcare tuition. So if you want to be able to pay your providers or your staff more so that they stay in the field, ultimately they need to raise tuition. So it's again that never ending cycle that we're stuck in, that you raise your tuitions, well, families can't afford it anymore. But if you don't raise your tuition, then you have people quitting the field to go work at Quick Trip for $17-18 an hour, where they're only making between like 10 and 13 with childcare. So just understanding why it's expensive, why it should be expensive, and what we need to do to help support this field.
And y'all have a pretty wide reach. Is it 7 counties that y'all are
10.
10? Oh, even
10,
wider.
yeah.
Yeah. So
Yeah.
10 counties that you're working with, and are sort of like the main hub to be able to talk about policy, advocacy, resources, training, to referrals, all of this, right? Like you're kind of the end
Yep.
all for child caring.
Yep. So Good Start Grants is just one program of child
Right.
caring. So we also offer child care referrals to families. So we help families find child care. They can contact us. We take some information from them, and we can get them a list of child care providers that match their needs. We do more of we do try to include openings, but if anybody's in the world of child care, that there are no openings right now, and B, it changes day to day. So we always tell the families to take that with a grain of salt. Like they could have openings today, but tomorrow it could have changed. And then we do provide training and technical assistance to the child care providers. We offer startup assistance for people that want to come into the field. So as you were talking about how these programs overlap with all the different areas of that you were talking about, we do try to help that expansion, where we do have some grants available for providers to start a child care. And then again, we're out in the community advocating for early childhood.
Yep. Thanks so much, Rachel. I want to go ahead and also introduce Lauren Gantz, who's on the call as well. So Lauren Gantz, if you'll remember, is the associate professor and the coordinator for the Women's and Gender Studies program. And they have a scholarship, the scholarship directed to student mothers from Portage County attending UWSP, helps reduce that financial burden in order to gain that, sort of be bona fide with your degree, with that undergraduate degree. This improves long-term financial stability and enhances their competitiveness in the job market. So Lauren, a little bit about this scholarship and what it does, and what you're seeing or the kind of feedback that you're getting from scholarship recipients.
Sure. Thanks for having me. So, yeah, the scholarship goes to a Portage County resident who is a single mother responsible for supporting children under 18, has no financial support from family, and is attending UWSP at least half time. Most of them that apply are attending close to full time. And they need to have 30 or more credits. So some folks have completed their associates at other institutions. So we've been offering this since about 2008, I believe, was the first time that we applied for funding to do this. So over the years, I did my calculations based on the records I have. We've awarded scholarships to about 24 women, and given them about $20,000 worth of financial support in that time. And, average tuition at UWSP is about $4,000 a semester, or close to $4,000 a semester, for full-time students. And our scholarships have ranged anywhere from $500 to $1,000 each time we give them out. So that $1,000 does often make a big, big difference with those students who apply. Since I have been at UWSP, I've had the opportunity to help select some of the scholarship winners, and I've also kind of collected all of the applications and had a chance to look through all of them. And so, almost all of them have, a lot on their plates, obviously, with multiple minor children. So some of them are widows, some of them are divorced, some of them are survivors of domestic violence, and they're all just kind of trying to make ends meet both for their children and themselves. And they often, don't have much money left over after child support or Social Security payments, Pell Grants, federal, financial aid, et cetera. So they really do need that financial help, and we are happy to give that to them when we can. In terms of success stories, we actually one of our winner from 2022 actually just ran for U.S. Senate. She tried to primary Ron Johnson. It didn't quite work out, but she finished her degree in political science and international relations here in 2024. So yeah, I think our most recent winner is also like pre-med. So a lot of them have these really big goals for themselves. So it's nice to see a lot of them reaching those.
That is wonderful. Are there any surprising impacts that you've learned from students that have been able to utilize the scholarship?
I mean, the
yeah,
Senate run, I
it's
think,
pretty
is the
good.
big one. Yeah.
That's so wonderful. And you, with women's and gender studies, you have access to some of the data that UW has done in terms of the challenges of being a caregiver in academia. I wonder if you can speak to any of that study at all.
Yeah, so the Women's and Gender Studies Consortium of the UW system put together a task force when the pandemic began to kind of look at the impacts that COVID had on caregivers. So they were primarily looking at faculty and staff, but they did have some respondents from students. So they gave a survey out across the campuses. There were about 1,000 people who replied. 3/4 of them were women, which should tell you something. And about half were caregivers of children. Another 16% were caregivers of adults, and about 8% were caregivers of children and adults. And women reported a much more dramatic increase in caregiving hours per week than men who replied. About 30% reported 11 plus more hours on average of caregiving in spring 2020. And then about 20% in fall 2020 reported also having 11 plus more hours than usual of caregiving duties. Faculty and staff reported kind of the highest increases, usually because I think a lot of us our schedules are relatively flexible. And so a lot of people really kind of had to figure out how to juggle all of their responsibilities. Women of color in particular reported the greatest increases. So there was a lot of reduction in both the amount of time that folks were able to spend on work, and a reduction in the quality of the work that they were able to do during that period. So about 50 to 60% of respondents reported an increase in job dissatisfaction and an increase in mental health struggles during that time period. So the task force put together a list of recommendations for the system to adopt, including offering more flexible working hours and work modalities for folks, taking caregiving duties into consideration during performance evaluation so people wouldn't be penalized if they had to spend more time on caregiving than on, say, like research. and publications, working to train, supervisors about the strains of caregiving, developing caregiving communities and curating more resources. So that's kind of the big recommendations that came out of that task force. And then they've also been holding student caregiving forums kind of off and on over the last 5 years, focusing like on how caregiving fits within Title IX protections and might fit within course accommodations for students. And so forth, to kind of give faculty a better idea of what student caregivers need from us so that they can meet their goals. So I think that's the bulk of what we had, but I do think we actually just had a win at the system level. The graduate students at Madison, the union, managed to get paid family leave for everybody, paid parental leave, which we had not had previously. So hopefully that's also something that will help to ease the burden of caregiving for our employees.
That's really wonderful to hear. I'm eager to understand how a lot of these recommendations are then moving into action. It seems a lot of times that's the hardest hurdle of them all. But to be able to have a win like that, hopefully will also perpetuate more conversation and more action within all of that good work done within the recommendations. Thank you so much, Lauren. I want to move over to Kathy Junion. Again, she's with the Family Crisis Center with CAP Services. So the Family Crisis Center provides support services to victims of domestic violence and sexual assault through programs such as emergency shelter, legal advocacy, counseling, and community education. So Kathy, a little bit more about that program, and also just a understanding to kind of bring us to the start of this conversation, the real, the known, and then maybe the not so known financial barriers women face in those abusive or
Sure.
violent environments.
Sure. So our services are 24/7 free, confidential to all victims of violence, domestic violence and sexual assault and interpersonal violence. So another piece to our program is we also have a youth shelter here. So having 24/7 services, crisis line, anyone can call, free, confidential. We also have walk-in services that are underneath that umbrella as well. We provide advocacy services, safety planning. We offer support in court prep and restraining orders. We have outreach here who can provide accompaniment. We provide support to victims of sexual assault. When advocacy is needed, we respond to the hospital and stay present with the victim if they so choose during their SANE exam. So the question, can you repeat your question again for me? Financial barriers? Okay.
Yes, yes. Mhm.
There are many. So because of domestic violence and sexual assault, a tactic uses isolation. So it could prohibit somebody from seeking employment, or if they do have employment, measures are often made to make it so that they lose their job with missing work or harassments or certain things. Affordable housing is absolutely a financial barrier too, in regards to trying to find a safe, affordable housing within our county. Finding employment that is sustainable to help pay for childcare, employment, health insurance, and all the things needed, and basic needs such as food. Transportation is another financial barrier too. We have limited busing in our community in order to get, could you imagine taking children on the bus to get them to childcare and then getting on the bus again to get to your job? There's just layers and layers. I heard somebody talk about this, the cycle of, all the barriers, and we certainly navigate that with those we serve. So healthcare is another financial barrier too. So.
Kathy, how does, and so with the challenges of being in those abusive environments or toxic environments,
Yes.
there is that definite financial barrier in all that you've already described. What
Yes.
are some of the other obvious and maybe not so obvious barriers in being able to become separate from that, independent from that in a sustainable way?
Fear, judgment, um, yeah, fear of leaving that relationship, fear of what it might be without the person that they love, because there's love there, or how are the children going to be taken care of if I do choose to leave? How am I going to afford all this? So fear is probably because they've been told many a time that they're worthless or unable to be successful without them. Judgment from other people of leaving that good person, they're such a good person, how can you do that? So factors of domestic violence. Some abusers use tactics of creating crazy making behavior, so their victim is the one that looks like they're the ones at fault for, oh, she left, she's crazy, or so I would say that's probably the greatest, is fear, and then judgment from others, and fear of being alone. It's new, it's different.
What are the challenges that Family Crisis Center is facing? Sort of recently, we've had certainly a shift in federal funding that then trickles through the states. So, what are those challenges, and how are y'all moving forward?
Sure. In October, we lost over $1 million from our VOCA federal funding. So you may see us a lot in regards to social media and requesting funds and wish lists. And we continue to educate people. We continue to get out there and try to do some outreach in regards to how this is impacting our services. We've had a staff reduction too. So being 24/7, we're all spread out a little thin here, but we're doing our best in regards to, we're committed. We have a amazing group of passionate advocates. So we know what we need to do, and we're fulfilling the community's need in regards to what's needed to support victims of violence.
Thanks, Kathy.
Can I put we're having a fundraiser, actually. We're 3 counties, Wapaka, Waushara, and Portage, and there's a fundraiser for the Family Crisis Center that's happening in New London on April 5th. It's called Mom Prom. So I'm just gonna put a little, we're looking for raffle baskets, we're looking for sponsorships, and of course participation. It's a big weekend for our community. There's a couple other big events, one in Marshfield and also one in Stevens Point. So there's a lot of really wonderful organizations that are looking for our support. So encouraging everybody to support a program and support one another.
Thank you so much. I did go ahead and put in the chat the link to that event there in New London that Kathy has described. Yeah. And I also just want to point out that Child Caring has also offered a couple things in the chat there in terms of some of that data, especially for our area. And then Christine Klessig had a question about data identifying heightened need and support for women from the agricultural sector. Certainly, I know Christine through the Wisconsin Women in Conservation. I think I have that backwards, network. And so does anybody have, I don't know that anybody on this call is connected to that agricultural piece. But I'm intrigued and to do some digging there to see what those numbers might be here, especially in central Wisconsin, Christine. We'll move over to, is Stephanie on? I know you didn't get pinned. Are you still on?
Yep, I'm here. Can you hear me a little bit better now?
Yeah, you're garbled, but as long as you speak clearly, I think we can pick you up. So Stephanie Wirch is the youth mental health advocate with CAP Services. And CAP is another partner that we have in mental and behavioral health support among our grantees here today. So that mental health navigator program with CAP Services provides direct client services and community education to support women and children's mental health needs. The program served approximately 160 individuals in 2021 and has increased efforts to focus on women and children, establishing partnerships with organizations like school districts and public health nurses, OBGYN offices, et cetera. So Stephanie, how does this program of CAP services function in order to provide that mental and behavioral health support?
Thank you, Sarah. And I'm happy to be here today to talk about our program. So mental health and navigation, it's a free and confidential service that we really try to be as open and as accepting and meet clients where they're at. Normally, we are referred clients through word of mouth, and they call into our program or they email us. We do a lot of outreach at events as well, so we get the word out there. And I think it's basically through word of mouth that the majority of our prevent suicide or Portage County residents call us. And there are several facets to our program. I'd say we're divided into 4 different kind of categories. We've got Portage County itself. I see your face. Is my sound still not working, or is it okay? Okay. So we've got Portage County, and that covers really anyone in Portage County 24 and older. Then there's the youth program, which I am the advocate for, and that covers every youth in all schools in Portage County, and including the smaller or the more rural ones like Amherst, Junction City, Rushholt, and of course the 13 schools in Stevens Point as well. And we focus 0 to 24 really is the age ranges that the youth focus on. We've got our Hmong advocate as well, because as you know, in our population, we have a very large distribution of Hmong Americans, now, 3 to 4 generations old, and here in the Wausau area, even though we only help in Portage County, but and then we also do help in surrounding communities of Waushara and Wapaka County as well. So overall, it's a very short-term service that we provide. Oftentimes, a client will call in or email us, and we will have 1 to 2 contacts with that client. And what we will do is whatever it is that they are needing as far as their mental health, we will provide a linkage to that service. So we can't expedite any mental health services. We can't get you into a counselor faster if you're already on a waiting list. But what we can do is we have a really good pulse for who is available in the community and also pairing you specifically to the service that you need. So let's say you're looking for an adolescent to help with psychological testing, but they would only want to see a male. We'd be able to pinpoint you specifically to a provider in our county that would work best for you. And it's not only therapy that we can provide referrals to. We also provide referrals for medication management, psychiatry, and even just providing resources. So a lot of workbooks, we support counselors in that way a lot, where we can send out whatever subject it is that you may need additional resources in. We can provide. We've got a very good and kind of calculated and data checked database. So, and then that's just kind of our client services, but as well as that, we do outreach, which is a huge part of what we do. Last year, we spoke to over 5,000, between the 4 advocates that we spoke to 5,000 people in Portage County last year on mental health awareness topics. We are all certified in Make It Okay presentations, which is about ending stigma and language that we use when it comes to mental health. We are also all certified in Question, Persuade, Refer, so suicide prevention training. We have triple P presentations available, which is available for families and caretakers and mothers. It's a really great parenting class for families. We also are Safe Zone trained as well, which is LGBTQ presentations that we do, and we do other topics as well. So Right now, we're working on some burnout and stress ones for multiple companies and organizations within the area that have requested that. So basically, whatever topic that you might need, we can get you a presentation for free. Yeah, so and we're very busy. We also are running multiple events as well. Our nearest upcoming event is April 2nd. It will be the Authentic Identities Expo, which is an LGBTQ youth and family event where we really just want people in the community to come out and be their authentic and true selves and support not only our LGBTQ youth, but our LGBTQ families. And we're April 2nd at Spash from 5 to 8. We have food, we have a presentation, we have a presenter, we have a live panel, and yeah, we're just over, I think 20 resource tables have already accepted as well. So we're just, however we can support the community mental health is what we're going to try to do.
Great. Thank you so much, Stephanie, for that like wealth of
Yeah, it's
sort
a
of
lot.
the information that y'all are taking on. Yeah. And for those of you who are interested, mark your calendars. I added the link there to learn a little bit more about that Authentic Identities Expo that CAP Services will be doing in April. Great. I want to touch back on just sort of how we see a lot of these issues that women are facing in Portage County intersect on their mental health. But first, before we get back into that, I want to talk with Brianne Constantino with the YMCA. What we got last year in the application was this really innovative program that the YMCA had designed for Parents Morning Out. So it was one Thursday each month for a few hours that there was available quality childcare for parents to be able to drop off their children and go do the things that they need to do that make it very challenging when you have a kid in tow. So it could be something like to just get some work done, to go meet a friend, to get to that doctor's appointment, to take a nap, whatever it was. And the thing that, you know, I think this is something that could easily go under childcare, and it absolutely is, but really where this sort of came within our funding priorities was that mental wellness aspect of being able to just provide a space for parents to go do the work that they needed to do and know that their kids were in a safe spot. So so Brianne, how do you see these the childcare issues and sort of lack of available resources for many different reasons in our area? How do you see that intersect with mental health?
Yeah, certainly. So I was just in prepping for this, reading through some studies, and one of them I came across from the National Institute of Health, specifically linked providing childcare and the reduction of potential abusive situations in the home, and then also helping to mitigate those caregivers that we talked about earlier. Having access to regular childcare oftentimes protects those moms or dads in whatever situation they may be from depressive symptoms. So the Y, obviously, we offer licensed childcare for birth through high school and all of those programs, but this program was really intended to offer something else to the community. So for those families who are not using regular childcare, but they still have those needs, right? We still have parents that need to go to the doctor's appointments, that really just need a break from their kids as much as we love them. Sometimes a break does everybody good. So this was really the intention for that program, was to kind of fill that void in our community as well. So it really was hugely successful. We ended up providing on those Thursdays almost 2,500 hours of childcare to families that really needed just a break, truly, right? So that was really impactful. It has gone fantastic. I mean, besides those things that I mentioned, like doctor's appointments and things, we also have a couple families that have foster children. So really just having that other outlet for something that is challenging and in the best of times, but helping to manage that foster situation just a little bit and ease that that stress and that choke point as much as we can as well.
What I also found lovely about talking with some folks who have utilized this service through the YMCA was just feeling that connection in the struggle and the challenge. Taking care of children is precious and such a privilege, but at the same time, obviously comes with a lot of those big challenges. So even seeing parents, when you're sort of leaving your kids there and making those relationships, it even sort of felt like from the stories that I was getting, there's kind of a Thursday morning club, just to be able to identify with like, hey, we're out in the community, we're using this great service, and we understand each other, the need for that.
And I think you hit the nail on the head. So a lot of those moms primarily literally would drop their kiddos off and you would see them leave the building together. Maybe they were going for coffee, maybe they just happened to be parked out there at the same spot, but really also helping to build those connections in our community was sort of an offshoot of offering this, not something that we were thinking of when we decided to launch it. But yeah, to your point, exactly, Sarah, is really helping to build those relationships outside of our walls too.
So do you see this program as being something that's sustainable to grow off of? Are there any plans that YMCA has to continue this type of mental health release for parents?
Yeah. So we have now upgraded it to every Thursday morning. With the grant, we were able to offer it for free on one Thursday a month. So at this point, it looks like we will be charging for it, but still a minimal cost. But we've also decided to expand that to parents' nights out. So one Friday a month as well, in the hope of helping to build stronger family units. Ideally, parents are going out together and spending some time together, absent of their children, to kind of strengthen community from that side of things as well.
Beautiful. All right. And then we have, I want to make sure we get in Angela here. So Angela Voss, y'all remember, is with the Boys and Girls Club of Portage County. And we were able to work, the Women's Fund was able to work with Boys and Girls Club on a before school care program. So can you tell us a little bit about that, Angela, and then the kind of feedback that you're receiving from parents?
Yeah, absolutely. So Portage Boys and Girls Club, we are primarily an after-school program. However, in Junction City, where one of our rural extension club sites are, there is no before-school care out there. So that's the one site that we have some before-school care at in Junction City, and that program runs in the morning from 6:30 until school starts. And that participation in that morning program is included in membership for any of our club members out at the Junction City extension. And it doesn't cost any extra for them. We just recognize that care is especially needed in those rural communities. I don't have the number off the top of my head, but we know that families face pretty long commute times out in rural communities. So the addition of having to find somewhere for drive a child to childcare and then go to work afterwards typically means families are having to leave earlier in those communities. So if school doesn't start until 8 in the morning, that's sometimes inhibiting families from getting to, or parents from getting to work. Again, something that is compounded, especially for our single family led households that are traditionally led by women. So we know that it's just a need in all of childcare is a need in all of our communities, but that's a specific program that we have that we are supported by the Women's Fund and supporting because we just really felt that it aligned with the missions of both organizations. So overall, families are very grateful for the program, and we are grateful to be able to offer that out in Junction City.
Are there plans to be able to continue that program, to expand the program?
Yep, as for the program, we have no intention of it going away. We are continuing to sustain it through partnership with the school district, partnership with grant funding from Women's Fund has helped with that. Another portion of that as we head into the summer. Some of you may be aware that there's been some restructuring to our summer school program this summer in Stevens Point, and due to declining enrollment, the Kennedy Elementary School is not going to be a location for summer school this summer. But we worked with the school district that we are still going to be offering Boys and Girls Club programming out in Junction City, because again, we know that families need that care in their community. Not all the families that we work with have the ability to drive into Point to drop their kids off at our Burrard Center in Stevens Point. So we are going to be, as we head into summer, continuing to offer programming out at the Junction City Kennedy Elementary School. So weeks that summer school is in session, we'll be offering wraparound care in the evenings that will go until 5:30. And then the weeks that summer school is not in session, programming will be running from 7:30 to 5:30. So we still have that before school full day care in the summertime out in Kennedy.
Great, thank you so much.
Yeah, absolutely.
A couple of things that have come up in the chat, if y'all hadn't seen, talking about who can access the YMCA Parents Morning Out. And so that is at this point a member, a privilege of membership. However, that the Y does offer financial assistance for those who that might be a barrier. And then Christine came on talking about this grandparent network. What are you talking about there, Christine? Give us a little bit of what you're thinking there. Oh, can you come off and mute? I'm putting you on the spot. Lower left-hand corner, probably.
Good.
There we go.
All right. There we go. Well, I'm not part of any particular network regarding grandparents. All I meant to observe was that I certainly know that my son and my daughter-in-law need a break occasionally from their 5 children. And so it's a win-win situation, because then I get grandma time. But I was just wondering if the YMCA had tapped into the resource of having grandparents, uh, provide childcare, maybe in a different setting at the Y, maybe in their usual setting. I think they might be successful in getting grandparents as the child care providers. I don't know if you'd have to jump through a lot of hoops to certify them. I'm not taking a child care class at this point in my life. I'm 75 years old. I should know how to take care of kids. Anyway, so those are my comments.
Yeah, that's lovely. I do wonder about any sort of like foster grandparent situation, if there's any kind of resources out there between Boys and Girls Club, YMCA, child caring, anything like that happening in our community.
We have a community happenings board in part of our Y, and I have seen up there a flyer for foster grandparents or something along those lines. I don't remember when I last saw that or what organization was facilitating that, but there is something happening in our community. I'm curious if somebody else on this call maybe has some more specifics about that.
I'll have to do some digging and see what opportunities may exist here. But I do think it's for folks who don't live near their family or have those grandparents or any other family members to help with the childcare responsibilities. And even if they do, it's always a need. And so maybe that would be a new population of folks to sort of see how that might be cultivated. That's lovely. Thanks, Christine. All right. So I just wanted to end our time here today with a question and answer session for any of our panelists here. From our crowd of folks attending, is anybody got anything on their brains, questions, comments that would be useful to talk about while we have all of these experts here? Well, folks are maybe thinking about that. So we have a couple of opportunities with CAP Services to engage in the work that they're doing and fundraising. I'm wondering if any of the organizations could share a call to action or an opportunity to engage with y'all, support the work that you're doing. Just come off mute. Hey, Angela.
Yeah, I can share. Boys and Girls Club's biggest fundraiser, Taste of Wine and Cheese, is coming up. It's our 20th anniversary of that event. So tickets are on sale now. It is scheduled for Friday, April 4th. So if you're interested, please come check out that event. It's a great time. Otherwise, for those of you who are specifically looking for childcare for the summer, our summer memberships do go live on March 24th, the same day as spring break. So if any of you are, personally looking or are working with clients that are interested in our summer programming, our summer programming memberships open on March 24th. All that information can be found on our website. So let me know if you have any questions.
Let me jump in there too. So we opened our camp registration for summer camp at Glacier Hollow, which is in Amherst Junction, last month. We do have some grant funding available for overnight camp. So if you in your professional roles know of some families or kiddos that really could benefit from the opportunity of YMCA Camp Glacier Hollow, please send me an email directly and I'll put my email in the chat.
Hello.
I can jump in here and, excuse me, and just ask that we have our friends out in the community that would be willing to share our agency information, even following us on Facebook and sharing our posts and information about our nonprofit agency to share out in the community for those folks, families that may be looking for childcare or may need some tools to help find quality childcare options, or even someone in the community that might be interested in starting a childcare program. We have, like Rachel said, we have startup grants and other resources to help folks get started. Of course, I have to throw in there that to help advocate for policies that can, excuse me, support children and families and childcare programming. And I'll also just share that we have a thank you card project where if you're a crafty individual, or even if you're not, there's ways to support this project. We're looking for homemade thank you cards every year for Childcare Provider Appreciation Day. We mail out thank you cards to approximately 300 childcare providers throughout our 10-county service area. So if you know of anyone that likes to make homemade cards, they can be sent to our organization and we will mail those out to the childcare providers. Thank you.
Oh, I love that. That's great. Yeah, Christine.
I wanted to thank Mickey from the Child Caring for her information provided in the chat regarding women in the agricultural sector. She says there is a workshop about childcare while farming, sponsored by UW Extension in Clark County, coming up on March 26th. And registration information, I certainly will pass that on to the listserv for Wisconsin Women in Conservation, because we have the whole point of that organization is to allow women, farmers, landowners, conservationists to be aware and connected with resources. Generally, it's been an underserved population in the past. And so I think several participants will be interested in this. So thank you.
Wonderful. All right, everyone. I think we have just a few more minutes here. I just want to thank big thanks to all of our panelists today. The work is unending. and it grows. And so I really appreciate the time to pause and join our panel here so that we can connect with all of y'all this afternoon, about these really important issues. The Women's Fund will continue to support the initiatives that are really centering women, so that we can make sure that we have a vibrant community for all. Women are those caretakers in our community. And so when we are able to pay attention and champion that, the women, then we're making this a community for everyone. And so thank you again for all of the work that is being done by these really important nonprofits.